What is measles? What are the risk factors, symptoms, diagnosis, treatment, and complications? Well, in this video, I'm going to let you know what measles is. I'm Dr. Farida Rajan Ibrahim Omasundi, and if you are new or you haven't liked this channel yet, or if it's your first time, please do like, share, and subscribe. So what is measles? Measles is a highly contagious viral disease that mainly affects children but can also affect unvaccinated adults. It is caused by a virus that attacks the respiratory system first and then spreads throughout the body. Although preventable by vaccination, measles remains a major public health problem, especially in areas with low immunization coverage. So what are the causes of measles? Measles is caused by a measles virus, which belongs to the Paramoxiviridae family, and humans are the only source of infection, meaning measles spreads only from person to person. Once the virus enters the body, it multiplies in the nose, the throat, lungs, and then spreads throughout the bloodstream. So how is it transmitted? What's the mode of transmission? Measles spreads through airborne droplets that are released when an infected person coughs, sneezes, talks, or breathes. So the virus can remain suspended in the air or on surfaces for up to 2 hours, and transmission can occur without direct contact, making measles extremely infectious. A person can spread measles 4 days before and 4 days after the rash appears. So the incubation period is usually 7 to 14 days after exposure. And during this time, the person has no visible symptoms, but the virus is multiplying inside the body. So symptoms begin suddenly after this period, often with a high fever. So this leads us to the signs and symptoms of measles. So the early symptoms, or what we call the prodromal stage, include things such as high fever that may rise rapidly and become very severe. There can be a persistent dry cough due to irritation of the respiratory tract, runny nose that is caused by inflammation of the nasal passages, red, watery eyes or conjunctivitis, sometimes with light sensitivity, general body weakness, and loss of appetite. Then comes the Koplik spots, which is small white or bluish spots inside the mouth, usually on the inner cheeks. It appears 1 to 2 days before the rash. These spots are highly specific for measles and help in the diagnosis. So after these Koplik spots, then comes the measles rash. So this rash mostly begins on the face and behind the ears, then spreads downwards to the trunk and the limbs. The rash is red, flat, and blotchy, often joining together. It appears 3 to 5 days after fever starts. As the rash spreads, the fever often becomes worse. This rash fades after about 5 to 6 days, sometimes leaving darkened skin. So what are the complications of measles? We have things such as pneumonia, which is the leading cause of measles-related deaths. We have diarrhea leading to dehydration, especially in young children. We have ear infections, which can cause hearing loss. Encephalitis, which is a serious brain inflammation that may cause seizures or permanent disability. Blindness, especially in children with vitamin A deficiency, as well as worsening malnutrition, which increases the risk of death. So how is it diagnosed? Diagnosis is often clinical, based on symptoms and the rash pattern. The blood test can confirm measles by detecting measles IgM antibodies. And the laboratory confirmation is especially important during outbreaks. So how do we treat measles? Treatment is there's no specific antiviral treatment for measles, but management focuses on supportive care, including fluids, nutrition, as well as fever control. You can also give vitamin A supplementation to reduce severity and mortality. And then complications are also treated appropriately, such as pneumonia and the other complications. So how do you prevent measles? Vaccination is the most effective preventive measure. So mostly the doses provide long-term protection. Yeah, so for isolation of infected individuals also helps prevent the spread of the infection. So what's the prognosis? Most people recover fully with proper care, and vaccinated individuals are well protected and rarely develop severe disease. So this was just a brief presentation on this condition. Please do share, like, and subscribe. See you in the next video. Thank you.